Assalamu alaikum. Today's article is titled The Incidence and Intensity of Postoperative Pain and Flare-Up Following the Use of Three Different Intracanal Medicaments in Teeth with Post-Treatment Apical Periodontitis. It's a randomized clinical trial conducted by a Turkish group and published on the year of 2024 in Clinical Oral Investigations. Postoperative pain and flare-ups are among the clinical complications encountered during and after endodontic treatment. And factors such as age and gender, presence of systematic diseases, condition of the bulb, presence of preoperative pain, number of appointments, and the use of intracanal medicaments or medications may stimulate postoperative pain and flare-up. And one of the most important causes of flare-up is microorganism that cannot be eliminated from the root canal or pushed into the periradicular area. And in retreatment procedures, although microbial eradication is mainly achieved by chemomechanical preparation, root canal medicaments may help to eradicate microorganisms from the root canal. Therefore, the aim of this study was to evaluate the effect of chlorhexidine, calcium hydroxide, chlorhexidine and calcium hydroxide mixture as intracanal medicament on postoperative pain and flare-up incidence and the frequency of analgesic use in teeth with post-treatment apical periodontitis. 120 patients met the inclusion criteria, which were patients between 20 and 65 years of age, patients who agreed to participate in this study, who has or had not used analgesics or antibiotic in the last 7 days. All of the patients had single root and single canal incisors, canine, premolar teeth that have been endodontically treated only once before. All of them had periradicular lesion and were all asymptomatic. All root canal treatments were performed by the same clinician using ProTaper Next rotary files, and after removing of the old filling material and performing the instrumentation and final disinfection protocol, first group received calcium hydroxide paste, second group received 2% chlorhexidine gel, and the third group received equal amounts of calcium hydroxide and chlorhexidine gel. And then the access cavity was sealed with glass ionomer cement. And the post-operative pain levels were evaluated for 7 days using VAS scale. In addition to the documentation, oral examination were performed on the 48 hours and at 7 days. Sensitivity on percussion, spontaneous pain, swelling of surrounding tissue, and antibiotic requirement were also examined and recorded. The results showed that there were no statistically significant difference between the distribution of the types of teeth in medicament groups, and when the correlation between age and postoperative pain is evaluated, at 12 hours, patients between the age of 35 and 49 had significantly greater pain compared to patients of 20 to 34 and 50 to 65 age range. There was no statistically significant difference at 3, 4, and 7 days, except for patients of 35 to 49 age group who had significantly more pain compared to patients between the age of 20 to 34. And additionally, no statistically significant difference was observed in the tested medicament groups when a periapical lesion was present, while patients with no fistula had significantly greater pain values after 24 hours compared to patients with fistula. And when the correlation between the apical extension of the primary root canal fillings and pain was evaluated, significantly greater pain was observed in the short and overextended groups at 24-48 hours compared to the cases with acceptable root canal filling levels. And finally, when the frequency of drug was investigated, a statistically significant difference was found between the groups, patients who received calcium hydroxide. So to conclude their findings, postoperative pain and flare-up does not seem to differ when calcium hydroxide, chlorhexidine, or their mixture is used as intracanal medicament. However, this study presents with several limitations, such as it lacks the split mouth design, and I think it would be appropriate to do this in these kinds of study. And they did not define and differentiate between the postoperative pain and flare-up.